Governor, if you would like to kick us off, I believe we have critical mass.
Great. Well, thank you very much. I spent some time actually last night writing down a few thoughts that I wanted to share with you today. And first, I want to emphasize that in my mind, this is a celebration, not a wake. And while we've had to dissolve the Oregon Health and Education Collaborative for some pretty straightforward financial reasons, it in no way marks the end of this movement that this organization and everybody here and so many people who aren't here were able to launch over the last few years. Our commitment has been, I think, and will continue to be in Oregon, where every child has an equitable opportunity to succeed, and where every pregnant woman knows where to go in her community to access everything that she and her family needs to ensure that her child will be healthy and successful in that critical first 1,000 days of life when 80% of brain development occurs. So, in my view, the only thing that's changed is the strategy by which we reach that goal, but not our resolve to do so. First, as you all know, and I like to emphasize this because I think it'll become more and more important as we go forward, science is clearly on our side. We all know that poor nutrition and maternal stress before conception and during pregnancy can alter the genetic expression in the unborn child and lead to cognitive functions and learning disabilities, but also disrupting those key early relationships that are so important for lifelong success. And so I think one of the things we've done over the last years, we have dramatically elevated the awareness that pregnant women and very young children and the families that they live in, if they're living in chronic economic insecurity and are worrying every day about whether they're going to be able to find a meal or pay their rent, live in this crucible of toxic stress that undermines everything we know about the healthy development of a brain in a child. And I think we've made the case, and I think it's really important in the months and years ahead that we continue to make the case that childhood poverty, which is really what we're talking about here, is not an act of God. It's a policy choice. And what we're about, and we will continue to push and advocate to make sure that here in the state of Oregon, we make different choices and we pursue different policies. So, long story short, we're not going away. I'm not going away, and I don't think any of you are going away either. Finally, I think, and this is very important, I think through the child success models, we've demonstrated that the structure through which we ensure that every child has an equitable opportunity to succeed have got to be designed by and operated from and embedded in the community itself. Beyond this larger, centralized, complex bureaucratic structure that's often impersonal and sometimes is not trusted by the very people it was designed to develop. So it's really important that we maintain and carry forward the work that started in these communities across the state of Oregon. I think that the fact that we were unable to pass the Child Success Act in the last session should be viewed not as a failure, but rather as a challenge. And I think one of the biggest obstacles, I call it the front end, back end problem, but the fact is the legislature continues to uh, fund children, I think, as an afterthought. And they in the legislative budget process, kids are really invisible until they're visible. And they're not expensive until they're extraordinarily expensive. I think legislators tend to fund acute crises over these kinds of investments that could prevent those crises in the first place. And they often listen to the loud, powerful voices of the education and healthcare lobbies, which constitute about 72% of the general fund, and don't hear so clearly the faint voices of thousands and thousands of young children whose futures are being unnecessarily compromised. I think that's really what we're about here. And that's not meant to be an indictment of either education or healthcare, but just a clear-eyed acknowledgement of the fact that a lot of the money we spend in those two sectors and some of the poor outcomes we're getting in those two sectors are a direct result of our failure to make these early investments. So being able to connect those dots, I think, is going to be critical as we move forward. Um, that's what, and I grew up in the 60s, as you know, and I remember the speech that Bobby Kennedy gave to the Cleveland the City Club of Cleveland the day after Dr. King was assassinated. And it was about the violence in America, but there's this one passage that I think rings true today. He said, "For there's another kind of violence, slower but just as deadly destructive as the shot or the bomb in the night, and that is the violence of institutions, indifference, inaction, and decay. This is the violence that afflicts the poor, the slow destruction of a child by hunger, or schools without books and homes without heat in the winter." I think the echo of those words reaches out to us over a half a century, because I think in a real sense it's the violence of institutions we're trying to overcome here. What we're trying to do is break down bureaucracies and transcend partisanship and move beyond organizations to outcomes. In so doing, fulfilling the responsibility that I think each and every one of us have to our children, to the next generation, and to the future. So I just want to close by saying that, it really has been one of the greatest honors of my life to be involved in this movement and to get to know all of you and to work side by side with you in common cause. And I just want you to know that you can count on me to continue to do so in the future if there's any way I can be helpful. And I want to leave you just with one of my favorite quotes from the late Vietnamese monk Thich Nhat Hanh. He said, "If I lose my direction, I look for the North Star and I go north. That doesn't mean that I expect to arrive at the North Star. It's just the direction that I want to go." So today, let's continue to go in the direction of generosity and compassion and equity and success for each and every child here in the state of Oregon. Again, thank you very much for letting me be involved in this great adventure. Ooh. Um, I think now we're going to kick it over to a few board members. I think Eric or Kamisha wanted to say something.
I'll
Eric?
let Eric go first.
Yeah.
Thank you. Thank you, Governor. This is sort of a tough deal for me because I was looking at old documents and the precursor to this organization, which I'm seeing on the document, was, what did we call it? We called it the Executive Roundtable on Health and Education.
That is it.
2019. Bob Stewart, who I don't see on here, hopefully Bob joins. It was on my board at Care Oregon, and we were just recognizing, look, they're between the healthcare sector and the education sector. They not only have a huge portion of the state budget, but they are the entities most efficiently poised to support children in particular, the future. But we're doing it independently and not coordinating those conversations. And so we said, let's think about how we work together to really get more bang for the buck, make 1 + 1 = 3, and really help children long term. And I found the proposed goals from that very first deal: identify the intersection of health and education and unmet needs of kids and families, and how best to improve the health of kids, families, and communities. Identifying strategies for healthcare and school districts to work together to improve the health of kids, families, and communities. Identify strategies for healthcare and school districts to best address the social determinants of health. Identify strategies for reducing disparities in health and education outcomes experienced by communities of color and other communities. Those were our goals, with one of the main outcomes to establish common ground system-wide in healthcare and education, as opposed to creating one-off relationships between individual organizations. When we started in 2019, we got some good traction, started talking about getting dental vans and dental in schools and behavioral health providers in schools and sharing information, supporting teachers. And COVID hit, put a lot of that to the side. And luckily, the governor gave us the blueprint of the Upstream Initiative to change our thinking a little bit about how we do some of this work. And I'm proud to say how well you all made that work, creating something really from scratch, bringing folks together, doing amazing work. And I think really creating that common ground, a system-wide collaborative organizations and conversations and communities at that level to say, what do kids need? And so I think it's been a success. Would have been better if we could have made it statewide and got the state engaged and had the funds to go all out? Sure, but I think we take advantage and celebrate what we did. It's great work. And as the governor said, this work's not over by a long shot. There will be other mechanisms, whether we have to create them or leverage them, that already exist to do those same things. Those goals exist. It's critical that we engage mothers and children early learning. I'm on the Early Learning Council now, so I learned so much more about the challenges that are faced out there. And I think that Care Oregon is behind this 100%. I am long term, and I know you all on this call are champions, and we'll find other ways to come together and to move this forward. But I just want to thank all of you, and really the appreciation I have is you can't even imagine, from just the ideas of a couple guys sitting in a room saying, "Hey, how do we move the needle?" And you made a real difference for kids. So I think we should be proud of the work done and plan on finding other ways to continue it. And I think we're going to do that. Oh,
Thank you, Eric. That was great. Kamisha?
Yeah. Well, good morning. Kamisha Robinson. I'm with Providence Health Plan, and I joined the board when I was with Legacy Health. So I believe I've been a board member almost 3 years. And honestly, I had a little chuckle when I was invited to this board. I was like, these are not my peers. Like, what am I going to do on this board? But I have been utilized, and I appreciate Chelsea for all the opportunities that she's kept all of us involved. And it's been truly an honor to participate alongside so many amazing people. Just a special thank you to you, Chelsea, for all of your hard work and dedication and creativity. I've never been on a board of an organization that was just starting. And so much respect to you. It's a huge lift. And so I thank you for making sure to leverage the board and our different talents to fold this in where it made most sense. I got to be part of our executive committee, was part of selecting our design pilots early on. I went with you as a board member to meet with other vendors and Murdoch and tried to show up where you asked me to. And so I thank you for inviting me in to do those things. It's been a great experience and I've learned so much from each of you. And so while others have said, while this chapter may be closing for us, what's been accomplished during our time has been so impactful, and our collective work will continue just through different vehicles. So thank you all.
Thank you very much, Kamisha. I think at this point, I'm going to turn over to Chelsea, the architect of all of this, the glue that has held us together, and who has worked, I know personally, so many hours above and beyond what was expected of her, and really was the soul of this organization. So Chelsea, would you just share a few thoughts with us this morning?
Yes. Hi, everyone. Thanks so much for being here. And thank you, Governor Kitzhaber and Eric Hunter and Kamisha Robinson for laying out some of our history. I mean, you all have been on the executive committee and have been on like all the committees. So I really was guided by your leadership. I'm struck by these comments I'm hearing you say that the vision was really to move beyond organizations and toward outcomes, to establish common ground that really is foundational rather than these one-off relationships. And I believe that we have done that, and that the legacy that we have planted here will continue to strengthen. What I'd like to do is just talk a little bit about the upstream initiative, since that was our flagship effort, some of the outcomes that we achieved, and how you might be able to carry them forward. And then we're going to open up the conversation. We'll hear from some of our design pilot partners, and also have a larger conversation in the last 10 or 15 minutes about ways that you are doing this work in your community, or ways that we can continue to support each other. So we'll close with the conversation about carrying it forward. Because today is really about passing the baton, right? And sharing ownership. And that's what this whole movement was about from the very beginning. So we're kind of going out the same way we came in. Let's see. I think also, in addition to expressing my gratitude to the board, who are a bunch of just really inspiring humans, I want to take a moment and express my gratitude to all the women over the millennia who have done this work in the first 1,000 days, before it was given a name. This is especially true of women of color, Black, Brown, and Indigenous women who practiced tending to birthing women, who practiced to caring for pregnancies, who wore babies and practiced early relational health, and still do so today, often for not enough compensation or recognition. So I really wanted to take a moment and honor all those women historically and contemporarily. So we created this 501(c)(3) with some pretty ambitious goals. We wanted to do all that systemic change, and all the outcomes over organizations, and the long-standing cross-sector relationships rather than the one-offs. And in the upstream initiative, we were really able to do that largely through our design pilots. Just a few highlights of some main outcomes that we achieved in the past 3 years. We did resource 5 design pilots around the state who all now have their local blueprints for what they want to do in their community to ensure that every pregnant and birthing woman and mom and dad and caregiver of a 0 to 2-year-old know exactly where to go. Um, with that, also, in addition to those design pilots, we did conduct a learning collaborative that included even additional communities, was professionally facilitated and had a researcher present. And that generated policy recommendations and cultural value transformations that we can press into as a state for years to come. And I will be sharing some of those resources with you during my talk this morning. Um, we had the Child Success Act, Senate Bill 1167, would have funded these design pilots, the beginning of the implementation of their blueprints, and also would have put into state statute the importance of investing in the first 1,000 days, the importance of early relational health and primary prevention. And that legislation had bipartisan support and passed the policy committee and was not funded in the 2025 session. Big shout out to Espousal Strategies and Mike Wessling and his team. For over a year now, they have been pressed into helping us with all of our strategic comms. And that effort is really important because we're trying to change the narrative here as well. We're trying to shift people's perspective toward the first 1,000 days, which doesn't naturally go there. And we're working to do things like destigmatize the need for support during this really important time period. And that requires that we change the hearts and the minds of people, right? That almost has to come first before policy or rapidly in conjunction with passing policy. So, how we communicate about this has been super important. And I trust that you all will carry that baton forward as well. Our work gained national attention. We were actually invited to attend Reach Out and Read and Nurture Connection Summit in Washington, D.C. We sent an entire delegation of folks from around the state. We trained them up. We lobbied our Congress people in the halls of D.C., and we sat at tables with early childhood advocates and pediatricians and parents from across the state. And people wanted to know what was going on in Oregon. We have a pretty good early childhood infrastructure here already. It's just fragmented and under-resourced. But Oregon is doing some really great things that the rest of the nation is paying attention to. And then we also began to, in the latter days, really look to scaling this. We were exploring other counties that would want to organize around the upstream initiative, really looking at adding more rural counties. Oregon is incredibly rural, and so we were looking at which regions were ready to do that and getting a lot of interest there. So I'll close with just one more comment, and then I'll drop into the chat when I am done talking so that I'm not multitasking. I'll be dropping into the chat our shared upstream measures framework, which it is an asset that is an outcome from that statewide work. So it's policy recommendations, but also indicators, system-wide indicators that agencies across the state care about that we point to as related to the first 1,000 days as a tool to organize communities. So with that, the upstream shared measures framework can be a little dense, a little wonky. There's also a toolkit for how you can apply it with steps, 1, 2, 3, 4. So I'll drop both those links as well as a slide deck that might help if you want to kind of cruise through shared upstream measures without reading a document. You can cruise through the slide deck. And I'll add that we will be working on open sourcing all of our assets. So we will post on our website. We'll also have partners who want to house some of this information. Things like grant language that we developed to apply for grant, slide decks, messaging, frameworks, toolkits, all of it is going to be available to all of you that hopefully you can use to sort of stand on the shoulders of or augment or accent the work that you're doing in First 1000 Days. This was my dream job. I would have loved to have done it for 30 more years if we could make it work. I have faith that I will get to work with many of you in the years to come across Oregon, doing this type of systemic change, really looking at how healthcare and education can work together to improve the outcomes of our youth. It is hard to pour so much time and energy and life force into something and then watch it, dissolve. But it's interesting. It's happening at a time in my life when my children also went to college. So it's not lost on me that this is sort of the nature of our work, that it's all impermanent and changing. We invest and then we launch and it shifts forms. So I'm holding that paradox of the impermanence of our work and also the ultimate importance of it. That no matter what form it takes, that we must do it, that it is imperative that we do it, and that we do make a difference when we do these things. So with that, thank you for giving me the chance to share a little bit of my story. Thanks for being here and listening. Thanks for being a part of it along the way. And Governor Kitzhaber, I can hand it back to you to introduce our next speaker.
Okay, thank you, Chelsea. And I'm sure I speak for the entire board that we are very grateful of all your hard work and also, I think, inspired by your articulation of the vision and I know your ongoing commitment to continue to stay involved. Marissa Loyland.
Yes, good morning. So my name is Marissa Loyland. I serve as the Director of Early Learning Initiatives at Intermountain ESD and the Blue Mountain Early Learning Hub. It's been an honor to be able to partner with the collaborative. The partnership has been meaningful and transformative for our hubs, our community partners, as well as the families that we serve. Our work together through the Upstream Initiative has focused on supporting children and mothers during the first 1,000 days, as Chelsea has referenced, beginning at conception, and has been especially impactful to our community. The initiative has allowed us to focus on the earliest, most critical development period and encouraged us to take time to reflect on what our families need to thrive. As part of our local process for design pilots, we engaged more than 30 agencies across Eastern Oregon. Together, we were given the time and the space to ask if anything was possible, what could we do to create this for families? The simple question opened doors. It brought our partners closer, strengthened pre-existing collaboration, and helped us identify not only what is working well, but also the gaps families continue to face in our region. The work has provided an amazing opportunity for the hub and its influence communities across the state. Through the collaborative, were able to develop our design pilot while learning alongside other communities throughout Oregon. We shared our ideas, challenged assumptions, and built a more connected statewide early learning network. We also had the opportunity to testify on a Senate bill using our voices and experiences to help shape policy that support children and families in Oregon. Although our Senate Bill 1167 did not pass, our commitment to families remained strong, and we continued our local efforts, continuing to ask the question, what do families need? Through this work and initiative, we began collaborating with Oregon Solutions, a statewide agency that helps communities move initiatives forward to help improve the well-being of Oregonians. We continue to work closely with Oregon Solutions and will continue to move our project upstream forward. Additionally, with the support of the collaborative, several successful design pilots were selected to participate in a conference in Washington, D.C. called Nurture Connection. Being part of this summit was an experience that will forever stand out in my mind. As Chelsea said, we got to lobby in the Capitol meet with government officials, and it was powerful insight into the cross-sector connections between education and healthcare, as well as deepen my understanding of the challenges that families face every day. At the conference, we were able to hear directly from families about what strengthens and supports them. We were able to hear from physicians and community health workers about the barriers they face by serving families. Then we were able to bring these reflections back to the community and identify the missing pieces. A key takeaway for me was an initiative that we learned about there called Reach Out and Read. This initiative champions the implementation of literacy into medical clinics by strengthening provider-patient relationships through developmental screenings and modeling the importance of literacy for parents. And I'm excited to share that now we will be having Reach Out and Read come to Eastern Oregon. The collaborative has given us tools, relationships, and inspiration that will continue beyond today. Even as the organization closes, the impact of its work will not. Our hub will continue to implement our shared vision and will work to continue to have a positive impact on children and families within our region. So, Governor and Chelsea, on behalf of the Early Learning Hub, thank you for your partnership and your trust and your commitment to Oregon's children and families. Thank you.
Thank you. And I think you were the only hearing in DC that actually had a baby present. Is that right? A new first.
Well, Courtney, our parent advocate, had a baby present, but our group was known for having the baby advocate with us. So that was very fun.
Great. We're going to get to Courtney in just a second. Let's hear from Claudia Rodriguez.
Yes, thank you, Governor Kitzhaber. And Marissa, I'm so excited that you'll be able to have Reach Out and Read over in your region. That's super exciting. Good morning, everyone. My name is Claudia Rodriguez, and I was the upstream lead for the Marion and Polk region. I work at the Marion Polk Early Learning Hub, and I am here with my colleagues, Kiara Yoder and Lisa Harnish. So if either of you want to chime in at any point, if I miss anything, I invite you into just this conversation. And I can say that being connected to this upstream initiative over the last couple of years has just brought so much enrichment to our work and our region. I would argue that if you are a part of this call today, you understand the importance of children and families, and also understand that it takes a village to raise a child. And I would argue in order to really establish that village, we need to be good villagers ourselves. So even though some of this work is coming to an end, and in a certain way, this work will continue moving forward within our respective areas. And I'm excited to just continue being an advocate for early childhood and continue promoting just family stability. One of the things that we continue to solidify and just learn through this work is that early childhood is just the framework, and just this work is really heavy and complex and often siloed. And through the collaborative, the work that we've been doing, we've been able to create different partnerships, both with families and also just other partners in different areas that maybe we wouldn't necessarily always come in contact with. And we were able to create our child success model and really identify some of the areas that we wanted to focus on in here regionally as a way of just promoting just children well-being. We've been able to do all sorts of things, everything from like hosting listening sessions to the work that was just mentioned by Marissa and Chelsea over in DC. So really advocating at a federal level. And also just within that, realizing that there's a lot of value in shared language, and being able to identify what that shared language is important if we really want to continue moving some of this work forward. We need to, as a state, get better at articulating early relational health and recognizing that it is work that is being done across the board, whether or not we define it like that, it is being done. And this early investment is important in order to really mitigate some of the barriers that we are seeing downstream. as we think about our work also moving forward, one of the things that we want to continue paying attention to is being able to collect better data and being able to tell stories from our data, continuing to make data-informed decisions. So looking at the data, but also being able to really pair up the stories and the families and being able to share narratives with our community in a way that makes sense. And within that, really emphasizing that relationships are infrastructure. So we often think about infrastructure as funding or programs, but these strong cross-sector relationships are just as critical. And the trust that is built over time with different peoples and just being able to create this rapid response around coordinated advocacy is essential to this work. So I know that as I think about our organization here, we will continue focusing on having that central framework of the first 1,000 days being a priority. We will continue to embed just early relational health across our sectors and really wanting to build a lot of, again, this framework and bringing in its importance in the different spaces that we enter. We want to continue centering families and family voices in the work that we do across the hub and across our region, and also really being able to lean into this not being a pilot or a pilot or just something that we added on, rather than really thinking about this as a norm, so a standard way of supporting families. So really all families being able to receive what they need early on as a way of just mitigating barriers down the line. So the groundwork has been laid, and we will continue sustaining this momentum and just deepening our work. And with that, I know there will be additional time for commentary, but I will invite Lisa at a later time to just continue sharing some of the other amazing work that we've been able to do.
Great. Thank you very much. Is there anyone else from Marion Polk County that wanted to say anything at this point, or do you want to wait till the end?
Well, we
Know.
can certainly wait to the end. I just want to underscore what Claudia so eloquently shared, that this really has, I think, shifted all of our approaches in all of our work as an early learning hub to be more focused on prenatal to age 3 or through age 2. And I'm just so appreciative of the opportunity to do that. It's afforded us the opportunity to make different and meaningful connections with our community. It also has reshaped or shaped much of our work and our approaches. And while, today really is about passing that baton, but I really feel like that baton, it's landing in hands here in Marion and Polk, and we're just excited to continue this work forward, and we will look for additional ways to scale it up when we think about the real policy shift and the state level shift that we all so desperately want. And hopefully our work here as a design pilot, as well as the other design pilots, will continue to serve as that blueprint. So thank you. It's been an honor.
Thank you very much, Lisa. Let's turn to Courtney now. Especially, I want to hear the details of your trip to Washington.
Thank you. I think I first just want to say thank you to you all, even though I haven't been able to meet all of you yet. I am Courtney Carter, the parent leader that Chelsea asked to go to the DC summit with. And I'm just so honored that I got to be pulled into this work and into this loop. It's something very near and dear to my husband and I's heart. If you don't know, because I don't know how much Chelsea's told you of me, our oldest son just turned 12 in the fall, and he was born with a multitude of medical issues. He's disabled, uses a wheelchair. We're using augmentative communication, still ongoing medical issues. So that's kind of our background into early childhood intervention and it's ongoing with him now. And then our second son had some speech delay, but because I knew where to get services before, I sought out those services for our second son to get early intervention and get his speech going. And he's thriving now in kindergarten and speaking really well. And um, so that's kind of how I think I got pulled into this through Marissa and Chelsea. And I'm just honored that I got to do that. And yeah, Washington, D.C. was uh, quite the experience. Like Marissa said, something that will always stick in my mind. I got to bring my baby. She was, I don't, it's like 7 or 8 months at the time. And she kind of became our little mascot over there. You can imagine in a room full of pediatricians and all the early childhood advocates. That was really fun. And yeah, my husband and I are super into this work. So I hope that you all feel encouraged that I'm part of this as a parent and not somebody who's actually in the work. You guys are making a difference and we're here for it. So keep my email, I'm sure it's here somewhere. Keep my email, my contact. My husband and I love to help further this work forward. I am also working with Marissa still over here in Eastern Oregon. I think we have another meeting in a couple of weeks. So thank you all so much for pulling me into this and letting me share here again.
Well, thank you. And you're such a powerful spokesperson because you're sort of living what we're trying to do, and we hope that you continue to stay engaged and serve as a resource for all of us as we go forward. So thank you very much. Chelsea, I'm a little confused about the agenda here. Is this the place where we just open it up to anybody?
You know what, Governor Kitzhaber, I was so used to you knowing everything that I don't think I kept you as well informed as I did the other speakers. What we're going to do now actually is move toward looking ahead. Um, and we do have one other board member who is going to speak about ways that the work continues. That's Lisa O'Connor. And then after Lisa speaks, I'm going to invite one of our national partners, Dr. David Willis, to speak a little bit as well. And then we're going to open the floor to everybody. So go
Excellent.
ahead, Lisa.
All right, shall I?
You're on.
Okay. Hello, I'm Lisa O'Connor. I'm the Executive Director of the Family Nurturing Center, and I too had the privilege of serving on this board. We learned a lot from these projects, and I just have to say that connecting with families earlier has been a goal of mine for years. And so getting the opportunity to utilize what we have all learned through this process is really exciting. And I should just mention that Family Nurturing Center is a relief nursery. We serve a continuum of child and family services, all with the intention of preventing child abuse and neglect by stabilizing families as early as possible. So from what we've learned, we know what they've showed us is that what's really possible when systems truly align. These projects revealed what the barriers that keep families in distress. We see it all the time. Fragmented services, duplicative eligibility requirements, navigation burdens that are placed on exhausted parents, and systems that are often compliance driven rather than prevention focused. I believe that families do not lack strength. They are navigating systems that weren't designed to work together. Now we have an opportunity to actually operationalize what we've learned. And so I just want to share a little bit about that with you. I should just mention also that substance use disorder during pregnancy, early childhood, it is one of the largest contributors of foster care involvement. And so with our particular project, we're going to focus on perinatal with SUD as a way to try to really make some headway with families in our area. So in partnership with Oasis Recovery Center, they are a primary care organization that works with families with kids 0 to 5, much like we do. We were founded by the same founder. We have aligned board members. We've worked together for years, so I'm really excited to do this implementation project in Jackson County. I also want to say that we are not building anything new. It's not about creating a new entity or anything like that. We're just about making what already exists work better together. Our agencies will maintain their autonomy. There's no restructuring, no consolidation, but we align around a common cause, strengthening families during the most critical development window in a child's life. Perinatal care, primary care, behavioral health, home visiting, developmental screenings, parent education, respite, navigation, all the things. So my hope is that since the services are here, what we're really proposing is just a coordinated trauma-informed continuum of care that truly has no wrong door. A universal support mindset where families receive what they need, not just what they qualify for. One of the factors that is exciting about this pilot project is that we will not be funded in a way typically to actually do the work, since it's work we're already doing, but some of the funding that we will receive will be able to eliminate that criteria for families so that we can actually serve them based on what they need and not having to go through the whole criteria process, which the design pilots determined like 98% of all supports that families received are all criteria based, which is a nightmare for navigating. So we're going to leverage the assets that are already in place, the coordinated assessment tools, developmental screening. We have a partnership with OHSU students, doula partnerships, peer mentoring, and our existing integrated work with Oasis. Then we plan to measure it. We're going to use the shared measurement framework developed through the Upstream Initiative, and we'll evaluate whether improving coordination actually shifts outcomes. I fully believe that it will. Our families more stable, our protective factors increasing, our children screened earlier, do fewer children under the age of 2 enter foster care, and are we reducing duplication and improving efficiency? So the first 1,000 days are our highest leverage point. If we get this right, we change trajectories, not just for individual families, but for public systems. My long-term hope is the same as the collaboratives and Governor Kitzhaber, is that one day in Oregon, any family who needs help during the first 1,000 days will know exactly where to go. No wrong door, no silos, just coordinated support that sets children on a better life trajectory. So the upstream projects gave us learning, the framework gave us structure, and now we have the opportunity to implement, to test, refine, and inform sustainable support statewide. Deeply grateful to the collaborative and all of you who believed in this work early on. Feels like the moment where learning becomes action and the collaboration becomes generational impact. So thank you guys. Appreciate you.
Wow.
I'm excited.
That's
Can you
very
tell?
so, did you write that? Is that written down somewhere, what you just said?
I have notes. I have some notes. Yeah.
It's really good. It's just
Thank
a
you.
wonderful and powerful, concise, I think, description of what we're trying to do, particularly the part about changing public systems from reactive to proactive. Yeah, thank you.
So I believe in it.
Is David Willis with us? That would be a real thrill.
I am a governor. It's great to be here. I'm delighted. As you know, I consider myself a forever Oregonian, and I'm so delighted with being with you all. Most importantly, honored about the importance of the seeds that were set a number of years ago around state level early childhood and community systems transformation that Governor Kitzhaber, you helped establish around the hubs and the Medicaid alignments and the and all of the work. Then the Upstream Initiative and the success planning with communities and families that has inspired everything that we're now likewise learning from, that we brought into what's called Nurture Connection, which is a national network to advance early relational health and partnering with children and families for improving future well-being that's relationally centric. I'm housed at Georgetown, but we have a national network that's become a catalytic network for change. And this good work has deeply inspired the national leadership. You heard the comments from the design pilot teams that came to DC. Yes, Courtney's baby was the mascot who, when there were presentations happening from the podium, our cute little baby was sounding off, making voices. And so relational health was alive in the room of our gatherings of people that nationally are deeply committed to everything you believe in. And you've been an exemplar of what can be, what needs to be, what will be. And OHEC planted seeds, sprouting were the communities, and those sproutings are continuing. Not only what you're doing in your state, but there are many other communities that are listening and learning from what's been built from Oregon's vision, and others learning and adding too. Nurture Connection is committed over the next years to continue to convene the communities And I'm delighted that some of the Oregon communities here will continue to partner in learning together as a collaborative, and we welcome that good work. We're likewise building from the framework of the upstream framework that Chelsea and OHEC built into adding to what is a now national task force of building early relational health field indicators and flourishing that will be meaningful back to community transformation and change. And then thirdly, we believe deeply in parent leadership as the center of all this work and transforming this work around communities for the family experience. So I commend the project. I know that even though it's in transition, Chelsea, what's been built is now integrated deeper into the vision and the opportunities that other states, other communities, not only in Oregon, but other states and the locales are really interested in moving forward. So thank you to the good work, John. Thank you, Chelsea, for your leadership, and then to Oregon's community landscape that is astoundingly important to this movement. It's great to be a part of this work. Thanks.
Well, thank you very much, David. I've known David for many years. He helped get my son on the right track when he was very, very little. And David's been an inspiration to me for how tenacious and committed he's been just consistently over the years. And you're doing some incredible work there, David. And we're glad we could contribute to that. Yeah. Chelsea, I'm going to just turn this back over to you because you ultimately are running this operation. I'm reminded of being where I was in the middle of the night by a nurse in the ICU who would say things like, "Doctor, don't you think we need another bit of potassium nitrate to this particular patient?" I go, "Oh yeah, that's absolutely." So you're pulling the strings, not me.
Oh, shared ownership. This is, in the last like 5 minutes or so, an opportunity for everybody to just pop in. If you're a board member and you want to say something about why this work is important to you, I invite you to say that. If you're one of our partners around the state and you want to speak to something that you're going to carry the torch, I'd like to hear that. So opening the floor.
I'll jump in, Chelsea. This is Maggie Bennington Davis from Hillshare. I've been a board member, was part of the original executive roundtable that Eric referenced. And coming from the healthcare side, sometimes healthcare is sort of the behemoth in the room, and I think we try really hard to think in terms of cross-sector, but this experience has been deeply cross-sector without healthcare being at the center. Just, one of the really, it's been an exercise in putting early life at the center and then everybody figuring out their role. So for me, it's been a very humbling and inspirational experience to just be part of this board. And Chelsea, you have been absolutely amazing. So great work.
Heidi. Go ahead, Heidi. And then I see you, Judy.
I've also been really honored to be a part of this from for a very long time. And the one thing that I'm so inspired by seeing still happening today is in K-12, sometimes it feels like we just complain or we just get treated as though we are complaining. And the thing that's been so inspiring to me about this group and the work that's been happening is the realization that foundations matter and that the starting days of a child's life matters and that all of that is leading up to these outcomes later on that are matters that are important to all of us. And the one thing that has never dwindled in any of this is the passion of this group and the dedication of each of the members. And I'm so thankful today to see that everyone remains passionate, remains committed, and I know that the work will continue. And I just want to make sure that I thank both Chelsea and Governor Kitzhaber because both of them have been absolutely instrumental to keeping us going, keeping us organized. And I'm just very thankful to all the board members, everyone involved, but especially the dedication of the two of them.
Thanks, Heidi, and thanks for everything you do out there as a superintendent. Ella. Judy, and then Kali.
Great. I don't want today to pass without giving my just heartfelt thanks to the governor, Kitzhaber, and Chelsea, and all the partners that I got to interact with around the state in the pilot. I feel like this initiative really has shown a light on the first 1,000 days, which we really have needed to happen in our state. So much of early learning on people's mind is childcare and preschool, which is extremely important. But we all know that if we don't get to every parent and child, and when women are pregnant and then kids in the first years, that's the most profound time, I believe. And so this has been a chance to really try things out. I know in our Lane County was one of the first pilots, and I am really excited and energized to continue our pursuit of cash subsidies in a universal way, because I think it was Lisa that was talking so much about the silos and the eligibility requirements. I mean, it makes people crazy. Every pregnant woman and every child really deserves its start. So thank you. And we went far. If we hadn't had budget issues, I believe we would have been successful funding our pilots. So thank you all.
Thanks, Judy. I have appreciated seeing how you're carrying the torch on that direct cash assistance in your community as well. Kali.
Hi. So Kali Thornlett, I've also had the privilege of being part of this from the beginning and want to thank Chelsea for her leadership and Governor Kitzhaber for his vision, which has been consistent, pushing us to look at this. I just wanted to say, I think the collaborative is what Bridgespan Group calls a field catalyst organization. And field catalysts are vital to an ecosystem because they catalyze transformative change. And just listening to everybody talk today, it's very clear to me, none of this was percolating in the same way. The alignment, the focus, it has been catalytic and transformation for Oregon and is laying a foundation that can only be built upon from here. So I do think that there's been a lot of success and that we are focusing on a population, as Governor Kitzhaber said, where 80% of the brain is being developed. And we have designed systems through these pilots to work better so that there's no closed door, as Lisa so beautifully articulated. So I just think there's so much to celebrate. Children's Institute is now setting up a behavioral health or early relational health table, and I think a lot of this work has been foundational to that. So just thank you for your leadership and vision.
Thanks, Kali, for being such a strong voice for our children. And the Great by Eight slogan that Children's Institute is living into is really, I like it. It's catchy, it sticks, it's sticky. Brent.
Yeah, thank you, Chelsea. I'm Brent Berry, Superintendent of Phoenix Town Schools down in Southern Oregon, and like many of and privileged to be a board member with this collaborative, and just have learned so much from just my fellow board members, and just every time we got together, we've just been so impressed. See many of you in different circles, and just really excited to really just know you and continue this work. Before really kind of getting on this board, I knew we were fairly lucky in Southern Oregon. We've had Peter Buckley in doing Southern Oregon Success, and Lisa's work with Family Nurturing Center, and it just made me continue to be proud of the work that's happening here, and even more motivated to help communities around the state, especially the underserved communities around the state, to provide the access they need in that early childhood opportunities. Governor Kitzhaber once, a couple years ago said, "Hey, would you be an advocate for freeing up some K-12 money to move towards, first 1,000 days?" And now more than ever, I'd be a champion for that. That my superintendent colleagues may not all agree on that, but we know when kids are ready and can regulate and ready to learn at kindergarten, we can catapult that into lifelong success as well. So I'll commit to that. I'm just happy to be a part of this group. And Chelsea, thank you so much for your leadership. Super impressive. You're not going to take long to find a job, and we might have one around here for you. So thank you. And thank you, Governor.
Thank you, Brett.
We just had two award-winning superintendents from the state of Oregon say that they would back K-12, sharing a portion of their funds for the first 1,000 days. So thank you to both of you. I think 2017 and 2020 were the years you won awards, something like that in your communities. I remember seeing Heidi speak at the OSBA conference. Anyways, what I could go on and on about the amazing board. I know we're out of time, and I don't want to keep people Zoom hostages. I'll say I will stick around in case you want to chat a little further. But I'll go ahead and close officially so you can leave. And we heard earlier that it takes a village to raise a child. And I heard somewhere along this journey that it takes a child, it takes a baby to raise a village. And I really like that metaphor. So let's use this first 1,000 days to continue to raise our village of people who are working for the best for our youth around the state. So thanks for being here. I'll stick around for a little bit and be in touch.